What is overall response rate?
Are often curious when they get started on new treatments, what is their response to treatment? And response in myeloma is sort of, we define it in multiple ways. We define it based on the reduction of their M protein or their light chains. If it's more than 50%, it's called a partial response. If it's more than 90% response, it's called a very good partial response. Or if it's complete reduction and elimination of the M spike in the blood and the urine, and then it's called a complete response. And then in clinical trials, when we're assessing a drug's efficacy or how well it has done, we use this term called overall response rate. So it takes all the patients in that treatment arm and assesses, basically combines them, and whether it's VGPR, very good partial response, or CR, the culmination of all of that is overall response rate.
The overall response rate. So when we do, what is the overall response rate? When we test a particular agent or combinations of drugs in a group of patients with myeloma in a newly diagnosed setting, the relapse setting, we determine how efficacious is this combination, this drug, and we follow patients, determine are they responding to therapies, the myeloma regressing. And so we do have some criteria. They're called the International Myeloma Working Group criteria. And for instance, if we have a 50% reduction of the myeloma at time of diagnosis, so before we start the particular combination, is called a partial response. And then if we have more than 90, or at least 90% reduction, is called a very good partial response. And then we have, stable disease, MR, which is minimal response, less than 25%. And then we have the complete remission. And with time, we're becoming more and more the responses criteria revolving, right? I remember when I started to treat patients with myeloma, we were very content with the 90% reduction, a very good partial response, and complete remission was 0. And there was the near complete remission, the stringent complete remission, and when we don't detect the myeloma in the blood, in the bone marrow, if we do imaging study, we don't see new lesions. But now we also use the minimal residual disease test, where we go more in depth, and the minimal residual disease can be performed in two ways, two methods, using a flow assessment, a flow analysis, when the pathology analyze, for instance, 1 million cells and determine, with 8 to 10 colors analysis if there are residual malignant plasma cells, or using the genome, the next generation sequence of the tumor from time of diagnosis, and if we see copies of the particular. So the overall response, and just go back to your original question, is, for example, if I have a 70% overall response, it means that 70% of the patients that I'm studying experience an objective response.
The overall response rate is the percentage of patients who have a partial response or better to a therapy. It's a direct measure of a drug's ability to kill tumors and is often used to evaluate new cancer therapies in clinical trials.